Hello and welcome to SPG Fin Dialogues webinar. I am Divya and today, in the light of World Thalassemia Day, we have congregated experts to join us in supporting and contributing to this year's World Thalassemia theme of Beware, Share, Care, strengthening education to bridge the Thalassemia Care Gap, to raise awareness about thalassemia, a genetic blood disorder that affects millions of people worldwide. We are honored to have an esteemed panel of experts with us today who will share the knowledge and insights on bridging the thalassemia care gap, the prevention, policies, global strategies, and progress. Our moderator for today's discussion will be Anubha TANEJA-MUKHERJEE from Thalassemia Patients Advocacy Group. She is a prominent voice in thalassemia community and has been actively advocating for the rights of thalassemia patients for many years now. Joining us on the panel first is Dr. Amita Mahajan. She is a senior consultant, pediatric, hematology, oncology, and Indraprastha Apollo Hospital. She is the chair medical advisory of Can Kids and serves as a medical advisor at Thalassemia India and Foundation Against Thalassemia. Dr. Mahajan has been actively involved in the care and management of thalassemia patients and has made significant contributions in the field of pediatric hematology and oncology. Our second panelist is Urvashi Prasad, the Director Office of Vice President Chairman, NITI Aayog. Urvashi has extensive experience in public policy, health and development. She has been working closely with the government to develop policies aimed at improving healthcare outcomes in India. Last but not the least, we have Manjira Sharma, the Head of Communications and CSR at Roche Diagnostics. Manjira has over 20 years of experience in communication, CSR, and sustainability. She has been actively involved in various CSR initiatives aimed at creating awareness about thalassemia and supporting thalassemia patients. Together, our panelists bring a wealth of knowledge and experience at the discussion today. We have that through this webinar, we can raise awareness about thalassemia, share information on prevention, policies, global strategies and progress, and strengthen education to bridge the thalassemia care gap. Thank you, and over to you, Ms. Anubha.
Thanks very much, Divya, and I think it's a great opportunity and a great platform. Being a patient, I feel extremely overwhelmed that I'm having this opportunity to moderate a session that has a doctor, a policymaker, and also a corporate leader. So welcome to all of you. And I think, of course, I'm biased and I will start with my doctor. So with that comment, I will start with Dr. Amita Mahajan. Dr. Mahajan, usually on 8th May, there is this practice of, interviewing patients and, celebrities also talk a lot about thalassemia, that how it impacts the lives of patients. But today, since you are sitting here, I would really like you to please, in very simple language, if you were to tell a layman what thalassemia is, and how it in general impacts the lives of patients, and also talk a little bit about how it can be prevented.
Thank you, Anubha. It's truly a pleasure to be here. And the biggest pleasure is to have you as a moderator. I mean, almost everything that we work towards is to create, or hopefully in some way contribute to the development of individuals such as yourself, which makes all the medical journey worthwhile for everyone. Thalassemia is a hereditary disorder. 3% of the world's population, including Indian population, are carriers for thalassemia. A carrier is a healthy person. They will never have any problems related to that. But when two carriers marry, which is fairly, you can see, when two carriers marry, which is quite common in our country, then they have a 25% or 1 in 4 chance in every pregnancy that their child will have thalassemia disease, which means that the baby gets the abnormal gene from both the carriers who are otherwise healthy individuals. Now, getting the thalassemia disease or getting the unhealthy gene from both parents means that the vast majority of these children will require regular blood transfusion from the first year of life till their whole life until they are offered some curative treatment. It also means that from about 1 to 2 years of age, they will need additional drugs to get the extra iron out of their system. Bone marrow transplant does offer a curative option, but despite efforts, because either for the lack of donor or the patient is not fit enough to undergo it, and sometimes still financial challenges, it is not an option available to all. So as you can understand, this poses a tremendous burden on both the patient themselves and the family. Also maybe to an extent at the healthcare system, but the impact on the family and patient, and really unless they get good guidance, it can sometimes be overwhelming. So, that is what it means to the patient. But I also want to say that with optimal care, most thalassemics or all thalassemics can really, you're a living example yourself, and I'm so happy that you are moderating this session, that most thalassemics with optimal care can really lead very healthy, productive lives and achieve their ambitions, aspirations, and dreams. But they do pay a cost for it in terms of the physical, emotional, psychological, and the financial burden on the family. So that is why, whilst it is our utmost responsibility to care optimally, and the policymakers, the government, the CSR initiatives, all have come together in the last few years to make optimal care possible for virtually most of our patients. But we should still try and see that we can prevent this wherever possible. And I think we'll come to the prevention strategies in subsequently. And at the moment, again, the medical community, the policymakers, the CSR are again engaged in conversation as to what would be the optimal strategy for prevention in India, because it's not so straightforward.
Thanks, Dr. Mahajan, for that very brief response to a very complicated problem that thalassemia is. So, since you mentioned burden on healthcare system, and that is something that we talk a lot about, because we know that the government has this philosophy of greater good of the greater number, and there's only so much money, so much resource, and they have to divide that. So with that thought, I will go over to Dr. Prasad, Dr. Urvashi Prasad. And I don't know how many of you know, but I have been following her very diligently on social media. And to me, she's not only a policymaker, but I see her as a strong voice for change. And she herself comes across as somebody with a lot of spunk, and somebody who's a go-getter. So Dr. Prasad, if you can bring both the elements of your personality, not only that of a policymaker, but also a woman, and also somebody who feels generally very strongly about change. What is the thought process sitting in a premier think tank like NITI Aayog? What do you think is the thought process within the government, and then your own thought process with regard to prevention and management of disorders like thalassemia, where you can save people, but at the same time, you can also prevent the very disorder. So what is that general thought process and thinking?
Yeah, thank you for the question. Am I audible to you? Yeah.
Yes.
Okay.
Yes.
Okay. So yeah, I think it's been a process of evolution, and I still see it as one. I think we've made some important strides, but we still have a long way to go in terms of fully providing the kind of patient centric care that we should aspire to in a country like ours. So I think when it comes to thalassemia, we are certainly moving towards looking at it from a national perspective. In fact, the Directorate General of Health Services is, even as I speak, working on a national level plan. Much like we have tried to have for sickle cell and some other conditions,
Right.
a similar sort of approach for thalassemia. And I think a national level plan is very important because there's so many different elements. Dr. Mahajan spoke about the prevention and the screening. There's the whole blood transfusion aspect, so safe blood donation, and how do you screen the blood, and make sure that it's perfectly safe for use. And then obviously the treatment related aspects, the mental health of patients. I think that is something that perhaps we might not talk about as much, but what does a disorder like this actually mean, right, for somebody who has to live with it day in and day out. So I think that is why a national plan, which I'm quite hopeful, which is in the works, at this point, and I'm hopeful that that will actually give us a very good trajectory. But in any case, I think the focus very much needs to be on prevention, on screening, because we are such a large country. We cannot put, you spoke about the burden on the health system. We cannot afford to just wait and watch. We cannot afford to just have the numbers go up and we have more and more patients. That would be a very unfortunate situation and a very difficult situation also for the health system to manage. So I think the disproportionate focus very much has to be on the prevention awareness, screening aspects. Are people even aware of this? Do they, like you said, we need to talk about it in very simple terms. What is the disorder even? How do I even screen myself for it? How do I even be careful about this? So I think those are the elements that we really need to focus on. And I think some of that focus is coming, but you will see a lot more happening in this space, in the days to come on all these fronts.
Thanks, Dr. Prasad. That's music to ears, because I belong to that generation, and I won't tell you my age, but I was born at a time when people didn't know anything about thalassemia. There was a problem pronouncing thalassemia. It was such a rare kind of a disorder, and now there's so many people talking about it, and you even mentioning a national level program. So we'll talk a bit more about it. With that, I would like to ask my dear friend, my colleague Manjira. And Manjira, you represent a corporate, and so do I in during the daytime. So both of us know what it means to represent a corporate and what perception issues are also attached. And sometimes one thinks that, okay, corporates, if they are saying something, that must be for not for charity but for business, so on and so forth. But you and I and all of us sitting here know that there's more to it. And with that observation, I would like you to comment on what do you think is exactly the role of corporate, keeping in mind the business objectives. Nobody's ruling that out, but what kind of participation do you see for the corporate sector in, let's say, managing a disorder like thalassemia? Because for your company, it'll be more about, let's say, save blood and chemicals or solutions that are there for save blood. So what kind of participation do you envisage? And then probably a follow-up question to you later on, what would be the expectations of the government, of the policymaker, to make that partnership successful?
Sure. Thanks, Anubha, for wonderful questions. And first of all, I think, a big thanks to SPACFIN Dialogues for picking up a topic which is not just close to our hearts because you're a patient, I'm a corporate partner, someone else is a doctor. But I think it is the burning need of the hour. The WHO or anyone can have an observance day, have a theme. But unless we have these dialogues, there's always going to be very limited awareness. It's going to be a very textbook solution. Coming to your point about how do we as corporates, in my career as a communications professional, I think we need to start looking at corporates just as institutional partners, like any other institutional partner, a non-profit like Thalassemia India, a hospital, a blood bank, who represent a patient advocacy group. We are institutional partners, and we are talking about the cause. We are not talking about a particular product or a commercial proposition here. And the cause is to do end-to-end manage the life cycle of a thalassemic and to make lives easier. Of course, Dr. Mahajan will have a role to play there. Dr. Urvashi Prasad will have a role to play there. So it is a holistic approach which institutional partners come together. And what happens, particularly, for people like us when we join, and why we joined, I think I'm just going to, backtrack a bit, was because we start highlighting issues which may not seem to be immediately visible as impacting the life of a thalassemia patient. For instance, in the case of thalassemia, along with the whole gamut of topics, Anubha, you and I have spoken often about it, Inclusion Under Disabilities Act, better care management. One very vital topic is the critical issue of availability of safe blood. Because thalassemia depend upon regular blood transfusions. Of course, there are other patient groups as well. And in the midst of so much policy intervention discussions, care management, this vital issue of safe blood often gets overshadowed because there are other concerns. There are budgetary issues. We understand that. As Dr. Prasad mentioned, India is a populous nation. So if you do not work towards a prevention first approach, and safe blood is very linked to that, and we can talk a little bit more about it, you will be in the health economic burden of it, the entire, that's not going to be a very sustainable model of conversation. So particularly pertinent to Roche Diagnostics, where I work, we've been spearheading these conversations with institutional partners such as private hospitals, blood banks, trusts, the NHMs, policy institutions like NITI Aayog, patient advocacy groups, non-profits, to simply create awareness about what is safe blood and voluntary blood donation. We know how important voluntary and repeat blood donations is, particularly for people who are dependent on these transfusions, and how serious are the ramifications of unsafe blood transfusion practices, especially for immunocompromised patients. So for the past 2 years, we've been running this mass media awareness campaign with partners called I Pledge Red, which involves various members of society to start conversation. We've actually extended the conversation beyond patient groups to the donor group. One feels very noble and active when one is part of a blood donor community. But you're donating blood, and before I joined Roche, I was one of them who have done my 2 mandatory blood donations in a year. Are you even aware that your donated blood could lead to infections? So this whole conversation about what is safe blood, that it is nothing but adopting the most advanced, the recommended screening practices to ensure that the blood which is transfused is free of infections. These are conversations we've taken to schools and colleges, because you have 18 plus donor groups there. So last year, I Pledge Red, we rolled it out across 8 cities in partnership with one of the largest hospital groups. Anubha, you were part, TPAG, TI were also part of the campaign. And we saw that the large colleges and universities in India, they all have very active blood donor groups. And while they're very keen about the cause of blood donation, they are not doing much about, they're not even aware about safe blood. We started conversations with regulatory and government bodies to see how we could drive awareness and also adoption. State governments, NHS, to show that, okay, if you don't want to, adopt that methodology of screening, perhaps here is a consolidation model. Have a big blood bank, do the screening there, incorporate and link it with the satellite blood banks there. So all of these conversations and measures are what we are driving, and I think corporates can play a very big role there.
Thanks for that, Manjira. Yes, we've been associated for a very long time now, and we've done all those campaigns and completely agree with, the kind of role that corporates can play. But I think it just needs to be highlighted more now that, corporates can be taken as institutes, and of course a balance can be maintained between, let's say, profits and social good. With that, I would go back to Dr. Amita, and let me tell you, the last question would be common, which would be your personal message or the message of your organization, let's say, on 8th May for World Thalassemia Day. So everybody gets a chance, except you, Dr. Amita, probably, to think about what you want to say. So that would be the last question. But before that, I'll go to Dr. Amita. Dr. Amita, do you feel that technology changes pretty fast? And for instance, since Manjira was talking so much about screening, we talk so much about screening when it comes to prevention as well. And in parallel, government makes, let's say the government made in 2016 guidelines on hemoglobinopathies. And these days one hears that we should include more technologies in those guidelines. Do you sometimes feel that science is changing faster than policy, and policy also needs to sort of change in parallel? And with that, do you feel that now we have more technologies, whether it be on the management side in terms of blood safety or on the prevention side? Because I know for a fact that our guidelines mention only HPLC, and now we are talking about point of care, we are talking about capillary. So as a doctor, sometimes do you feel that you want those policies to change more often, more collaboration is required?
Oh, you're absolutely right. The technology today definitely makes both screening of blood in terms of safety far more effective, and also prevention strategies far more feasible. And yes, they come at a certain cost, but we are learning more and more that the more you do and the more we engage with our corporate partners, it is feasible to bring the costs down. And cost economics will dictate healthcare in our country. We can't say that it doesn't matter. Of course it matters, because health is also just one subject. Within that big pie are multiple small sections, but we owe it to every patient to give them the safest blood and to give them effective prevention strategies. The technologies have been there for some time. They've actually become cheaper. And as we have more indigenous models, as we use them more, as we use better, in terms of cost effectiveness of a kit being used, we can definitely come with more cost effective models. In terms of policy and the government response, I think this is the golden era of government responsiveness in, with regards to healthcare. I think where the lag is that we have to go to them with a sound business case, a sound suggestion, because that has to come from the medical community and the scientific community. At the end of the day, the government is able to look at the pros and cons of what it can do, what it can deliver. So we have to come with effective strategies, and we have to come with that together. So I think little bit a consensus has been lacking within the community, within the advocacy community, within the medical community, as to how we can effectively deliver these strategies. I, for one, feel that adopting, say, a new technique like NAT testing nationwide, we can still make it cost effective, because with each product, with each blood unit, you are actually getting 3 products, and you are, potentially protecting 3 patients from an infection. And if we use it widely, with now which way, which technique we use, that we can discuss on, but we have to be able to sell it to the policymakers in a way that it makes both, economic and logical sense. And I think we have a very strong argument there. Now, prevention is a challenge because we have 25 million births every year in India. And if we look at it, 50,000 of those pregnancies are at risk of having a child with thalassemia. So if we say, start an effective program, it is a challenge for the government because they have to screen 25 million women across the country with may not have ways or means. But if we club them with other prevention strategies, we are already doing certain strategies right at birth. We are screening for 4 common disorders right at birth. If we combine it as a hemoglobinopathy screen for all our mothers, we engage our corporate partners in that. Many of it may be done in the private sector. So it is not as if the whole burden has to, but we have to come up. And I mean, the medical community, the scientific community, the researcher community has to come with a feasible action plan on which then government can make, firm decision making. And I think we are now coming to a point where consensus has been established. We have learned from other countries, from our own experience, what works, what doesn't work, and what is the cost to the system when it doesn't work. So I think we are now ready to come up with concrete proposals, both for safe blood, optimal management, and effective preventions.
Thanks, Dr. Amita. I'm sure many people who wonder a lot about policy, and of course, I'll quickly go to Dr. Prasad also to let her add to that. I'm sure many people will find that eye-opening. So, Dr. Prasad, one keeps wondering if you are not really in that policy making zone, or if you're not, interested in law and policy. One just wonders, why is the government taking so much time? So that's the general perception. But now we know that there is a wave of, let's say, doing policies more expeditiously. More policies are happening, more law is getting enacted. So give us a tip. How can we possibly ride that wave? One thing that Dr. Mahajan has clearly said is that, we need consensus, we need strategies, and we can't go to the government just with emotional appeals. We have to give them proper arguments. But is there something you would also like to add, that what do we do? I mean, there was an era, pre-2014 era, when we used to feel really left out. Now that is no more the case, but we still want that more attention should be given in terms of let's say save blood, and how one can talk about mandating certain technologies. How do you as a policymaker think we can retweak our strategy to get that attention? A tip from your side, and also a little bit on policy making in general. How does the government do that?
Yeah, I mean, I think what we have been trying to do now increasingly is move towards evidence-based policy making. So actually the evidence, of why something is a problem, or why something works or doesn't work, that evidence is very important. And I think that's what Dr. Mahajan was also alluding to, that sometimes you want to do something, and you want to even put the resources behind it, but you might not always know exactly how to execute it. And in a country like India, this is particularly challenging, because our states are so varied. That's why I'm saying that, only now, when we have some amount of learning from our different state governments, are we actually looking at, a national level plan and how that might pan out? Because ultimately, as the center, you have to learn from states. The center on its own, in isolation, cannot make policies. So I think the know-how, of how to go about something, we have to get that, whether it's from our medical fraternity, whether it's from the private sector, whether it's from civil society. The Red Cross, for instance, often has some very good initiatives. So there's always things that we can, learn from those. And I think what the government can really bring to the table is the ability to scale up, any such initiative. So that is obviously an inherent strength that any government brings to the table. But we certainly need the know-how, we need the technology, what is the latest technologies that are available. And the cost element is very important, which is also something Dr. Mahajan mentioned, that it has to be cost effective in a country like ours. if we have to do it at scale. So I think those are, some of the critical elements. And in fact, we spoke about blood safety through the NAT, the nucleic acid testing,
Yeah.
and also the voluntary, blood donation, etc. So in fact, these are also elements that the DGHS is working on, and they've also been working on a manual for blood transfusion, services and voluntary blood donation guidelines. So I think there's a lot which is in the works, and hopefully we're going to see a lot more coming out in this area. I think the government clearly recognizes it as a very important area. Whether it's thalassemia, whether it's sickle cell disease, there's definitely a recognition that these are very important challenges. But as I said, our policy making approach has to be evidence based. It has to be calibrated. It based on what have been the experiences of our states, experiences of our other partners, and we certainly need help from the other partners in scaling up. Whether it's in terms of technical know-how or technology, whatever that might be, or just best practices, what has worked maybe in other countries, what has worked in other contexts, or, what might have worked in one state of India. How do we scale that up? So I think all of these are areas where the government, needs to partner and has to partner for any, policy making initiative to succeed.
Thanks, Dr. Prasad. So there is consensus that yes, it has to be all evidence-based and all stakeholders need to come together to make it happen. So the last point that Dr. Prasad mentioned, Manjira, that encourages me to ask you, what do you think? I'm sure when people are talking so much about cost, when you go to the government and you tell them NAT and they tell you, it's very expensive and we can't make it mandatory, it's a state subject, so on and so forth. What is a corporate's reaction, or let's say response to that kind? What is your comeback to that kind of a comment? And do you do some studies, or do you internally deliberate that how can we possibly work on the cost in a manner that probably volumes take care of the cost? Or what is the strategy that you generally work on when such problems come your way?
Right. So cost, as we all know, especially as Dr. Mahajan mentioned at the very onset, that the government also has to prioritize. These conversations come up. We work with 3 state governments: Madhya Pradesh, Odisha, Jammu Kashmir, who are the only 3 in India to have mandated NAT screening across their blood banks. So what we do, and we have partnerships with third-party research agencies. State-wise, we do HEOR studies to show the health economic benefit. Do not look at cost as the cost of per unit of blood being tested. Look at the ramification. 1 unit of blood, separate into components. If you transfuse it into 3 patients, the likelihood of an infected sample, actually infecting 3 people. Managing the entire life cycle then of a patient who may contract hepatitis, may contract HIV. What does that look like? We have data and all of that. Not only that, Roche being a global player, we have data from other countries who've successfully done it. Not just European or Canada or US, we have data from APAC nations, and we are more than happy to share that. So those are the sort of evidence which we go with, that do not look at it as a per screening cost. There are models therein as well. Look at the overall, what is the life cycle of a patient, the nightmare it will lead to, and something which we don't speak about, and Dr. Prasad mentioned, we still look at patients from a purely therapeutic curative angle. We don't talk about the mental health burden. Where do we have the luxury? If you were to put a dollar amount of that, imagine so we are equipped with all of that. More importantly, what we say is that engage us in the dialogue. The consensus building has to begin with, again, institutional partners. If the nonprofit is a part, has a seat on the table, because a nonprofit will bring in a perspective which I as a corporate will probably not be privy to. The blood banks will, who are trust-based versus the private hospital blood banks will bring a unique perspective. Maybe the private hospital blood banks will say that we want customers to pay for it, right? Also, look at smarter models. What we've done in states, the 3 states I mentioned, Odisha, Madhya Pradesh, and it's worked fantastically well in both these states. We begin with a pilot. We show the benefits, then we scale it up, and then we tell the NHMs and the SBTCs, these state blood transfusion councils, you do not have to do NAT screening at every blood bank across your state because we understand it's going to be expensive. That's not the model which other APAC nations also follow. Work on consolidation. When we are talking about TB, when we are talking, I mean, India handled so brilliantly the HIV crisis, which we all know. It was through that smart model. We cannot. So where necessary, you will go for a point of care. In the case of blood banks and NAT, you will do consolidation. And that can also work brilliantly. So I think we have evidence of the efficacy of all of that. And this is the comeback which we do. And therefore, Anubha, to be very frank, as you said, this is the golden hour. Post 2014, we've seen state governments, the central government being very receptive. They are engaging with us. They are giving us a seat at that table.
Thanks, Manjira. And you know, my favorite example, of course, you can always talk about, if the patient contracts hepatitis, then, you need to spend a lot on the cure. But I also love to give this example, which Dr. Amita also loves, is that somebody like me falls in that tax bracket where I pay, I'm at the top while I'm paying. So had I got infected, which I did in 1997, and I contracted hepatitis C, and I ended up wasting a lot of time. But had I not been treated properly, or had I got some other infected blood, I wouldn't have been a taxpayer. I wouldn't have been a lawyer. I would have been a burden on the healthcare system. So I think that aspect also, so to your point, that we need to take a holistic approach instead of saying that, oh, I can't spend $500 per bag. So thanks a lot, Manjira. With that last round, where the question is common, which is, what would be that one message from your side or from the side of your organization on 8th May, World Thalassemia Day, whether it be on prevention, management, cure? What is it that your heart says on this day? So, Dr. Mahajan, should we start with you?
Okay, so to every young person out there, please go and get yourself tested. For, you owe it to yourself, you owe it to your country, you owe it to the society. For every young person also, go and be a blood donor wherever it works for you. Blood, we should not, we don't ask any thalassemic for replacement donor, but no patient, no family should have to worry about the blood donor part from, whatever disease they have. So we all, as young, healthy individuals, we all owe it to society to be good donors, to be regular blood donors, and that is the need of the hour. For every thalassemic out there, we'll go a long way. We'll do our best that your lives are, as productive as Anubha is. She is in the top tax-paying bracket, and may you all be in the top tax-paying brackets. May you all your ambitions, all your aspirations, all your dreams, both professional and personal, they are fulfilled, and you lead fulfilling lives. And I'm extremely confident. I mean, I've been working with thalassemia now 25 years, but I think now, while other people may feel despondent, I just feel hope and optimism, because it's as if the stars are aligned, everything is coming together, all the stakeholders together, and next 10 years will be really, transformational, at least where hemoglobinopathies are concerned. That's the hope and optimism that I want to end.
That's a beautiful message. I wish all doctors were like you. So that's a very poetic and beautiful message. Dr. Prasad, what would be yours?
Yeah, I mean, absolutely. I'd echo what Dr. Mahajan said.
Dr. Prasad?
I would just around them who might be dealing with situations this. And because I think, empathy is really very crucial. If you're dealing with something or somebody around you is dealing with something similar. So I would just add to that, be empathetic, be aware, be informed, and try to spread the word as to achieve. So yeah, I would just say that much.
Thanks, Dr. Prasad, for that motivating message. Empathy, yes, that's very important. Ask patients about what it means a lot. So thank you. Manjira, what's yours?
So I'm just going to begin. I'm going to I pledge red. We say that we are the second edition. When I say I pledge red, I'm a proud advocate for safest blood for the people who need it the most. It's not just thalassemics. We're having this very important conversation on the eve of World Thalassemia Day, but for everyone who depends on transfusions, let's pledge to a standardized policy. And we are all there, and I request members of this forum to keep this consultation process with open, and so that we do what is best for patients. Make us a part of effective strategies and dialogues on optimal blood screening. It is whether it is NAT, whether the government or the states decide something else. Ultimately, we have to close the loop. We look at prevention. What serves the patients best is what we need to ultimately decide upon. It has to be cost effective. It has to be effective at the same time. And I just want to say that my last thing is, safest blood is a right. It is not a luxury. We cannot let it be a luxury. It is a right. Let's work towards that. Thank you.
Thanks, Manjira. And since you spoke the law, let me speak the language of PR, which is repeated messaging. And I say this at every forum, and that would be my message. Famous lines of Iqbal, where he says, "Khudi ko kar buland itna, khudi ko kar buland itna ki har tadbir se pehle, khuda bande se khud puche, bata teri raza kya hai." So that's my message to all my fellow thalassemics, that you should yourself be so self-sufficient that God asks you, what is your wish for future? So with those lines, I'll give it over to Divya, and thanks a bunch to all you ladies, and I hope we all have a great World Thalassemia Day, and we keep spreading this message of prevention, management, and cure of thalassemia. Thank you so much. With that, over to you, Divya.
Thank you so much, everyone, for joining on this important discussion today. And we really appreciate your presence and contribution to the significant cause. And so with this, we will bring this session to an end. And I trust this conversation on raising awareness about thalassemia has been very enlightening and has, reflected a deeper reflection. And so if you like this episode, do subscribe to our SPAG Fin Dialogue, and you can also visit www.spagdialogue.com for more engaging content and join the conversation on health and technology. Thank you, and we look forward to bringing you more engaging content in the future. Thank you.